The vision for the Skyridge Spine and Total Joint Center is to truly be a world-class destination facility for patients and surgeons. You'll notice a sign outside that says Odom Avenue, and Dr. Jack Odom, we call him our spine pioneer, really inspired us to create a center of excellence. When you work with top-notch surgeons, they're incredibly clear about the environment in which they want to practice to optimally take care of their patients.
I think the thing that attracted all of us to coming here was not only the facility itself being first-rate, but the first-rate administration who listened to the surgeons, ate lunch with them, and didn't live in an ivory tower somewhere else where the surgeons were excluded.
This community looks at Skyridge now as a flagship destination facility and a point of pride.
We have been able to build a team here and a program, and it has attracted so many patients and so many surgeons and so many nurses that want to work here because they can tell that we have really focused on quality outcomes and making this the best patient experience we possibly can.
That includes bringing the nursing staff together who love doing spine and total joints and provide amazing care for patients.
But what makes Skyridge different from most hospitals or any other hospital I've ever worked at is the people. The people in this hospital are caring, they love what they do, they're very professional, and overwhelmingly the patients love it here.
I feel more comfortable as a surgeon having everything at my disposal that I could possibly need, but I think it is impressive to the patients that they can get state-of-the-art care.
Excellent care in so many other areas such as physical therapy, the radiological services, as well as the inpatient hospital intensivists that give us all a very good sense of peace of mind.
Consistency really breeds greatness, and when you have the same nurses taking care of your patients, when they're all familiar with the equipment that we have in the operating room and where to find it, and it's all in one place, really going to make a difference.
We have an incredible staff that really takes superb care of people, and I think that's really the best part of the new Spine Center.
People will want to come here because not only do we have the team that has many years of experience and the depth of knowledge in regards to those procedures, but it's specialized and geared strictly towards just spine and total joints.
If I was a patient looking for a place to have an elective surgery with the kind of impact that a joint replacement or spine surgery would have on their lives, I would choose a place like Skyridge because they understand how important this is to the patient.
I think this center will enhance patient care because the more focused and the more volume that you do, the better the staff is and the better the doctors are. And the higher volume as well as the wonderful facilities that we have just basically perfect patient care.
It's a beautiful center. I think the patients are going to be very appreciative of it, and I'm very excited about it.
Recently I took care of a patient. We replaced one knee, and he couldn't wait to replace the other one because his life had changed so dramatically. He was able to go for walks without pain. He was able to lose the 20 pounds he had gained because he couldn't be active. And now he wants to run the Boulder with me next year. Although I don't typically advise that in all of my patients, I think I'll make an exception for him.
We do see a lot of athletes from the Broncos here. And again, I think that when you're looking at high performance athletes, if you're able to preserve most of the anatomy of their back, their musculature, their ligaments, but perform a surgical goal, that they do get better quicker and they can return to where they were before, where 10 years ago patients would have to retire or change or alter their life's plan in regards to their fitness or sports needs.
Well, to start with, this is a state-of-the-art spine center, and that's wonderful. But also, when the patient walks in, I can just see from the opening in the door, it's so beautiful inside, it's very relaxing, at least to the family.
when you see those outcomes and you see the patients happy with the success not only of you, but because of the hospital, that reflects on the specialty.
This facility is the main reason that I came to Denver, because a facility where you have large operating rooms that accommodate this type of surgery with state-of-the-art implants, state-of-the-art technology will allow me to do a better job of putting in the implants that I utilize and rehabilitating my patients.
I've considered Skyridge to be the premier tertiary care facility in this area of town. That when my patients query me as to why I operate here as much for the ancillary services available for my patients as I do for what's available to me.
We've been planning it for several years, and I think the staff and the administration have done a wonderful job to incorporate the surgeon's wishes.
This center has some unbelievably new technology that allows us to do minimally invasive hip and knee replacement with image guidance, which is not done anywhere else in the state.
This hospital represents the forefront of technology in terms of what we have in terms of spinal navigation systems, minimally invasive techniques, and an opportunity even for teaching.
What the navigation does for us as a physician, as a surgeon, is it allows us to localize exactly where we need to go during surgery using the patient's own anatomy. We're able to perform a lot more complicated tasks or surgical procedures safely.
I think in the last 10 years there's been just a tremendous leap forward. There's a lot of things from the advent of the use of bone morphogenic proteins in achieving fusions.
These rooms are 750 square feet with all the equipment incorporated into the room. Navigation systems, we have the latest in the type of tables we use, the latest in instrumentation, and all of that is feedback from our team and our physicians that tell us what we need to have to make this work most effectively.
We're standing on the shoulders of the people that came before us. So we're lucky to really inherit this great procedure, but we still are making advances, making the implants more durable, determining what implants work the best, using surgical approaches that minimize damage to the soft tissues, and really developing techniques to really improve a great surgery. It really has the potential to become a destination center nationally for joint and spine surgery.
First of all, it's a beautiful center, but just deeper than that, there, the operating rooms, the pre-op and post-op areas, and just every part of the center has been very well thought out, and it provides the best patient care.
I think the center will be a world-class facility that others will try to emulate.
I'm thrilled with the fact that we have a medical team here which is extraordinarily good with regard to our in-house care of our patients. Our physical therapy department excels. I'm thrilled with administration and the support that they've given us with regard to developing this type of centers.
This was a vision to take optimal care of unique patients. And as I look back over the 5.5 years, and our teams and these physicians have embraced the vision of best in class, this is the house they built.
Thank you.